The idea from neo-now Lord Kinnock that VAT should be put on private healthcare in the upcoming budget. He said it would raise billions of pounds for the NHS. Now, it's worth saying his idea of a wealth tax, which he said would raise in excess of £10 billion. He says removing the exemption on private healthcare would provide vital funding for public services, and he said be widely supported by the public. If such a tax was structured to give private hospitals a carve-out for any work they do for the NHS, it would still raise more than £2 billion, analysis suggests, which is a chunk of change. Let's get a view now from Dr. Tony O'Sullivan, who's retired NHS consultant paediatrician, co-chair of Keep Our NHS Public. Your take on this idea. Good morning.
Good morning, Nick. I think many people in the population will be very surprised that private companies are not charged VAT for providing healthcare privately. That's a personal choice of people when there's a public service available that's actually funded from taxation and publicly raised finance. And that's the way our taxation system works. The NHS needs the funding to meet the need. And it hasn't been having that, and it's been struggling very severely in the last few years. The private sector gets an unfair advantage. They get access to fully trained staff trained by the universities and the NHS itself. The private sector provide no training, they provide no ongoing education, they usually provide no intensive care or emergency support. They rely on NHS for rescue when things go wrong. They take staff and funding from the NHS and actually undermine the NHS to the extent that some departments, such as ophthalmology, are struggling to keep up with the needs of patients because private sector has drained resources.
Equally, Doctor, they don't take £180 billion each year of tax revenue.
The £180 billion of funding that the NHS requires, is far less than equivalent countries in Europe, and B, that money is actually the going rate for a service that's serving the needs of 65 million people in this country. And if we want a health service and a healthy population, we have to pay for it. And for the last 15 years, the reduction in funding relative to the growing need has pushed the NHS to the level of crisis. That is why there aren't enough GPs. That is why there's 100,000 vacancies.
I would have thought, Doctor, anything that helped ease that crisis, that is to say, if one of my listeners needed a new knee and he or she were able to pay for that new knee to be done away from the NHS lists, that's obviously helping another person who needs a knee, but Lord Kinnock wants to make sure they pay even more. How can that make sense?
Let's unpick that argument if you've got time. First of all, if an individual person is in real distress and needs an operation and the NHS cannot provide it, or the NHS is sending them to a private company paid by the NHS, I don't criticise that person for a minute. What we have to have is political responsibility for supporting the NHS to the level where it meets the needs of the population.
That'd be 180 billion quid a year, £3 billion a week.
Absolutely. It's not working as well as it could, partly because it isn't funded sufficiently. It's below what is needed. When a really good system is funded properly in the NHS out of public funding, it is more efficient than a service that's based on private insurance.